Good morning, good afternoon. My name is Alfred Turner. Today I will present information about the Department of Health and Human Services. I will provide information on the Health and Human Services uh, security and also the areas of improvement. What we're going over is the impact of legislation on the Department of the Health and Human Services, the Information Security Standard for the Health and Human Services, security assessment of the Health and Human Services, the summary / conclusion, and we will end with references. The Department of Health and Human Services is a government agency that is responsible for taking care of the nation's ill. The cybersecurity program at the Health and Human Services is responsible for ensuring compliance with the executive order, which is Executive Order 13636, the Cybersecurity Bill of 2012, and most recently the Health Insurance Portability and Accountability Act of 1996. And we'll be discussing these three in further details. First, we'll start off with the executive order. The executive order 13636 seeks to ensure that the national and economical security of the United States is secure and resilient in the face of the ever increasing occurrence of cyber intrusion and cyber threat. It shares the responsibilities and requires effective organization among critical infrastructure owners and operators. It makes sure that the organization adapts the best practice for cybersecurity. There was special incentives study required to be put in place within 120 days of the executive order being signed. But the preliminary version of the framework was given twice the time to be established, which is 240 days. The executive order was also put in place to improve the security and resilience of the physical and cyber critical infrastructure. Now let's discuss the Cyber Security Bill of 2012. The Cybersecurity Bill of 2012 covers the destruction or exploitation of critical infrastructure through a cyber attack, whether it's a nuclear power plant, the region's water supply, or any major financial market. Now, what will happen with this could devastate the American economy or our national security, and also it could threaten our way of life as we know it. In order to determine the greatest vulnerability, uh, Health and Human Services has to conduct risk assessment to determine which sectors are subject to the greatest and most immediate cyber risk. As sophistication of cyber threats and attacks has grown, it's increasingly clear that improved information sharing is a vital tool to combat cybersecurity and espionage, and to alert owners of our national and most critical infrastructure of cyber threats to their systems and assets. Next is the HIPAA. HIPAA, the Department of Health and Human Services enforces the HIPAA policy rules, which protects the privacy of individual identifiable health information. The HIPAA security rule, which sets the national standards for the security of electronic protect health information. And we have the HIPAA branch notification rule, which requires covered entities and business associates to provide notification following a breach of unsecure protected health information. And the confidential provision of the patient safety rule. And this rule protects identifiable information being used to analyze patient safety in the event and improve patients' safety as well. Here we will discuss the information security standards for the Health and Human Services. There are three standards which we are the data encryption standards, which is DES, the triple data encryption standard, which is 3DES, and the advanced encryption standard, which is AES. We'll start off first with DES. The data encryption standard, DES, which was the first of the three standards, it was introduced in 1977. It was one of the first encryption logarithm standards. It calls for the 56-bit key with 8-bit parity. It also has a 64-bit block size and is responsible for one of the weakest but fastest encryption. But now it has become obsolete as well. Next, what we'll discuss is the Triple Data Encryption Standard 3DES. This encryption is the extension of the DES. So I guess this takes the place of the DES. It applies the DES algorithm, but it applies it 3 times as strong, but with a large encryption key, which is 168 bits. It's very powerful, but this technology is also very slow. Next, we will talk about the Advanced Encryption Standard. The last of the 3 standards is the Advanced Encryption Standard, and it is a replacement for the DES.